I should have asked him. Are you having trouble sleeping these days? Not just the time change, but this pandemic. It's been something that I've been doing, staring at the ceiling all night awake, counting sheep. We're going to talk about some of the hidden causes of insomnia. We've decided this week is going to be called Sleep Week. We'll start it off after a break. So studies have shown that over the past year, many of our sleep habits have been completely out of whack. Since the pandemic began, one of the biggest issues affecting a lot of us is insomnia. And here's the thing. Things you do differently now compared to a year ago may be adding to your restless nights. I mean, that probably makes sense, but you don't realize it's happening. She is back with us. We're so glad to have Dr. Sheetal DeCaria talk about the 5 hidden causes of insomnia. It's not a one-size-fits-all, is it, Dr. DeCaria?
It isn't, and everyone needs to look at their own factors differently and figure out what might be a problem for them.
Well, here's the deal. We're kicking off Sleep Week here. We decided that this is something that we all need. This is all something we're not getting enough of. You're our inaugural segment, so let's talk about the causes. I think there's a lot of us, and I will include some of my colleagues and myself, think that maybe a glass of wine before bed will actually help me sleep.
A lot of people think that, and alcohol is a sedative, which means that it does make you sleepy, and so you may be more likely to fall asleep faster. But what people don't understand with alcohol is that it actually disrupts the quality of sleep you're having. It reduces your REM sleep, that's your rapid eye movement sleep, and so actually when you wake up the next day, you feel more fatigued, exhausted, and you don't feel like you had a good night's sleep. So what I recommend is instead of that glass of wine, try to drink some chamomile or lavender tea instead, because unfortunately, any amount of alcohol does impair your sleep.
All right, you can put it in a wine glass if that helps you feel better. Okay, the next one is you may have had in this last year, especially those of us that are, well, we're all getting older, but as you hit a certain age, you may have different medications that your doctor is prescribing you, and those could be keeping us awake.
A number of very common medications actually have insomnia as a side effect. So some of those are blood pressure medications, steroid medications, a couple antidepressants. So if you're suffering from sleep issues, take a look at your list of medications. If insomnia is listed as one of the side effects, have a conversation with your doctor. Sometimes it's as easy as just changing the time you take the medication, and that can actually improve your sleep that night.
And don't think that you're being a nuisance. Your doctor wants you to get enough sleep. I mean, we often think that they just want us to lose weight and exercise more, but they also want us to drink enough water and also get enough sleep. That's something that doctors like you will highlight. Okay, here's the big change for all of us: working from home, Zooming, and living on these screens. All of that can be affecting our sleep patterns.
Yes, so our sleep-wake cycle is highly dependent on light. And many of us have heard that blue light and light at night is going to impair your ability to fall asleep. But what's also important is that the amount of light you get in the morning also impacts the sleep you're going to have that night. So it's important to try to get some sunlight in the morning. About a 15-minute walk in the morning outside would be great if it's a sunny day. But for some of us, like me that lives in Chicago, we can't get outside or it's not sunny. And so what I do is I actually turn on a light box like this one. I got it off of Amazon for $25. I turn it on for about 15-20 minutes in the morning as I'm getting ready, and that's also going to lead to a better night's sleep.
You know what? I want to shout that out to Sumata and all of my other overnight and our editors and photogs and some of the stage crew. We're like these night dwellers. This is a good tip for a lot of us because our sleep cycles are completely bottoms up, and so a light box would be a really good tip for those of us because we're working in those morning hours. Okay, this is a big one for many people. It's that meal, your last meal of the day. There's a very good chance it could be keeping you awake.
Correct. Some of us like to eat a late meal or maybe a late snack. And so what we need to think about is not only what we're eating, but when we're eating. So fatty foods, foods that cause acid reflux or heartburn, that's something that can definitely keep you up at night. Things like chocolate, which is a common late night snack, has caffeine in it. But really the sweet spot is about 3 hours before bedtime. So if you can avoid eating your last meal anytime within that last 3 hours, you're going to sleep better. Because when your body's digesting food at night, it also leads to disrupted sleep.
Sure.
Right.
So what is a good snack before bed that will kind of calm you? I mean, are you going to say a lavender or chamomile biscuit?
So water is very good. Really something very light, something that's not going to be a heavy meal, and really try to not eat anything if you can 3 hours before bedtime.
All right, and maybe you have someone in your life or yourself is suffering from sleep apnea. This is a big topic. And I also want to, I hope you will help destigmatize it, because I think a lot of people are freaked out by the idea of sleep apnea, but there's a lot of help available now.
Yes, and a lot of us suffer from undiagnosed sleep apnea. So it is really important to make sure that you're not suffering from it and get treated if you are.
What are the signs?
There's something called the Stop Bang questionnaire. You can find it online or on my blog. It looks for things, it's a questionnaire for risk factors. So if you have high blood pressure, if you have certain size, like an obesity issue, if you are very fatigued or tired during the day and snore a lot at night, these are all things that give you a certain score that tells you if you're at risk for having sleep apnea. And if you meet that criteria, you need to discuss with your doctor having a sleep study, because issues with undiagnosed sleep apnea is that you can get heart disease, type 2 diabetes, a lot of different health issues are tied to not treating sleep apnea.
And if you are worried about this whole business of looking like Darth Vader when you sleep, we got to get over that. The machine, the CPAP machine, is going to help you breathe, and you're going to get a better night's sleep, and you're going to feel reinvigorated in the morning.
Definitely. And they have different machines now too. So people can choose different masks and stuff like that. So it is a little bit more, there's more options now.
Yeah, and by the way, technology changes all the time. I think that's an important thing to consider. Look, this is a great conversation. Sleep is a commodity that we need to hold close. It's very precious. We don't get enough of it. I need more of it myself. Dr. DeCaria, thank you so much for kicking off Sleep Week for us. And by the way, she's written a great book on pain, Break the Pain Cycle. It's her new book, and it is available now. Be sure to check it out. It's a great 90-day program. And also check out her blog, because, again, you can take that sleep study and answer the questionnaire. Good to see you, Dr. DeCaria. Take care.
You too. Thank you.
Thank you.